Business engagement in global health is absolutely important because this problem is so large, and I'm specifically now talking about maternal mortality, which is when a mother dies as a complication of pregnancy or childbirth. And this day and age, 1,000 women die every day. Just to put that in perspective, that is 2 jumbo jets crash every day, full of women, full of mothers, pregnant. And the irony is, most of those deaths are preventable. So when you look at the problem that is a multi-factorial problem, that's a system problem, when a mother dies, it's an indication of a system failure. And when it's a system failure, there's really no one sector that in itself can take care of this problem. So neither governments, nor the public sector, nor the private sector, nor businesses individually can take care of this. But it is time that the business sector jumped into this, because up to now it always seemed like these kind of system failure health issues were always the purview of the governments and the public sector. So I really feel it's time for the business sector to jump in. But one of the ways of looking at it is what is called creative capitalism. And for the business sector to jump in, it is not just all about philanthropy or about corporate social responsibility. This is also about strategy and doing well while you're doing good. And doing well and doing good are not mutually exclusive. So when we're saying the business sector needs to jump in, they need to jump in because they can do good. Business sector has, for example, expertise in supply chain, in market development, in management. We can bring all that to bear on this problem, but we can also do well and do good. And so the companies themselves, for businesses to come in, it's a wonderful opportunity to learn how can you do well and do good at the same time. That is really an excellent question, because you've left me a big opening. When you say forward, I thought over this, and I think the best way to explain forward is forward thinking, forward facing, and forward designing. And actually those are the 3 pillars on which Merck for Mothers is now rolling out its programming. Merck for Mothers is Merck's 10-year commitment, a global commitment to reduce maternal mortality as a complication of pregnancy and childbirth. Forward designing, the way I look at forward designing is innovation, and Merck for Mothers is looking at innovation as a way to be able to bring the most game-changing innovations into the hands of the woman, where she needs them, when she needs them, at a price she can afford. There are a lot of innovations out there. In fact, some people feel there's an innovation pile-up. There are about 40+ innovations out there in the maternal mortality space. Merck for Mothers has decided to see whether we can reduce that down to 3 game-changing innovations and then fund that. So when you say Merck for Mothers forward, I'm saying forward designing, and I'm using innovation as an example. I'm also using forward thinking as an example for our second bucket for Merck for Mothers, which is around access. A lot of solutions already exist. How can we accelerate getting them into the hands of the woman? How can these solutions reach the woman when she needs it? And in that regard, we believe forward thinking is really important. And as an example, when I was in Uganda recently, I met a private care midwife who is starting her own clinic and takes care of pregnant mothers. Now, her name is Mama Maria, and she has a clinic, and it's not a high-tech clinic. It's surprising for you to know that she runs this clinic for profit in an urban slum in Kampala. So here's a lady who's figured out that at $20 a delivery, she's able to keep her own family surviving. And this kind of forward thinking, where a business model to take care of the woman and not a donor-dependent philanthropy model, which actually engenders more dependency. So she has found out that at $20, she's cut her cost down to so much that at $20, she makes it worth her while as a business and to deliver these women in an urban slum, absolute poverty with no running water and no electricity. So that is forward thinking. How can Merck for Mothers galvanize more such Mama Marias? The third forward that I would like to talk to you about is forward facing. And that is our third pillar, which is advocacy. So when you talk about forward facing, we believe we need to be in people's faces. We need to let people know that 2015 will come and MDG is not going to go away. We're not going to achieve some MDGs, but the world doesn't stop on 2015. We need a strong policy advocacy footprint collectively as a global community made up of public sector, private sector, governments, United Nations. Everyone needs to come together. We need to be forward-facing. We need to be thinking in the future. We need to have strong policy and advocacy. So I've answered your forward in 3 different ways, which ties into the Merck for Mothers programming. I'm a physician, and I actually remember the days as a house surgeon in rural India trying to take care of these women who were dying. And the one memory that clearly stays in my mind, and I must have been 25 myself, it was cold, it was in the rural parts of India, and there was an 18-year-old who was having postpartum hemorrhage, which is bleeding after delivery. There's nothing more horrifying than seeing blood gush out of a woman, no way to stop it, and to see a woman bleed to death. You never forget that. What excites me the most is innovations to prevent postpartum hemorrhage. And right now, the standard of care that WHO recommends is oxytocin, an injection of oxytocin that is to be given as soon as the delivery happens to contract the uterus and stop the bleeding. But oxytocin needs refrigeration. It's heat labile. And it's the very same countries that don't have refrigeration have this problem. So quite often this oxytocin is sitting outside in the heat and is denatured. Can we come up with a heat-stable oxytocin? Very simple. Not too many people are looking into this because there's not too much intellectual property, not too much profit to be made, but that doesn't mean a simple thing like heat-stable oxytocin could not be a game changer of the future. So Merck for Mothers is looking at innovations such as that to see if we can bring these game-changing innovations, life-saving innovations to our mothers. There's no single barrier to a woman. It is a systems failure. When a mother bleeds to death, so does the nation. The way to think about it is, I don't know if this analogy works, but instead of a silver bullet, we need to think of it as a silver buckshot. We need to have a lot of small silver bullets at the right time, right place to take care of the 3 delays that cause maternal mortality. Delay in seeking care, where the woman, the family, the community, the husband all have to understand that maternal delivery is best done in a facility, and that antenatal visits are important, and that just because the mother feels she went to the back of the room and delivered, that she expects the daughter-in-law to do the same. So the first is we need to come across and remove all barriers around seeking care. The second barrier is getting to care. So the woman decides to go to the facility but cannot get there. There are no roads, there's no transportation, there's no ambulance. Can we remove those barriers where a woman has planned for transportation and to get to the facility, because otherwise she has to walk during labor pain 5-6 hours. And very often these girls themselves are 14, 15. And so can we remove those barriers of getting to care? Third barrier is receiving care. So when the woman gets to the facility, very often there is not a trained, skilled birth attendant, and the cupboard is bare. There is no oxytocin, or even if it's there, it's denatured. There are no commodities, there's no gloves, there's no life-saving medications, there's no anesthesia on this. So can we remove those barriers to have incentives in place to have right quality trained professionals taking care? So It's not one barrier, but we need to take away barriers for the 3 delays on seeking care, getting to care, and receiving care. Merck for Mothers is Merck's global 10-year commitment to reducing MDG 5, which is maternal mortality, mothers dying as a complication of pregnancy and childbirth. This initiative that Merck has undertaken is basically looking at the 2 big killers, which is postpartum hemorrhage and preeclampsia, and also seeing what role can family planning play in preventing maternal mortality. We basically have three pillars that we're focusing on. We're focusing on an innovation pillar to see if we can come up with game-changing innovations that will save the woman's life. We have an access pillar. We know there are many solutions that are already available. Which of these can we accelerate to reach the woman? And then we have an advocacy and policy pillar to see what can we do in the advocacy policy space to make sure that this is a burning issue and people don't forget that 1,000 women die every day. Literally, 2 jumbo jets crash every day. And what can we do to see whether we can prevent that? And our underlying focus on all this is to approach it not as a donor, where we want to just give money, and in that fish story, we want to teach people how to fish. And as somebody said, if you teach a woman how to fish, then the family survives and she starts a business and the community thrives. So can we empower, galvanize, catalyze the private sector? And when we say private sector here, we mean local healthcare providers and local businesses to care for these women in a business sustainable manner to make sure that our mothers are safe and we're saving lives. So we're really excited about this initiative, and we're working with many partners, and we hope to be able to make an impact on this space.